Dear students, we are still continuing with antenatal care and looking at what is most important. So at this moment, we are going to look at pregnancy and nutrition. And I'm Kiden Robina, still going to take you through this session. So pregnancy is a nutritionally demanding period, and during pregnancy, there is a rapid cell division and organ development. So changes in the body occur, and in most cases, there is a drop in electrolytes, proteins, glucose, vitamins, and rise in lipids, triglycerides, and cholesterol. So, in this case, it means that the mother's diet has to be balanced based on these needs that we have mentioned. She will need more of the electrolytes, and as you see, when we were talking about preconception care, we talked about those electrolytes that needed to be taken, those minerals that needed to be taken before conception. Then also during antenatal care in the first trimester, there are those supplements that need to be taken, more so the folic acid supplement, to make sure that it boosts the maternal content of the folic acid that she has, to make sure that abnormalities of the neuron of the spinal cord are avoided. Now, adequate nutrient supply is crucial for fetal growth and the maternal needs. Baby's nourishment comes from the mother's diet and the supplement. The mother on everything. So that is why the mother has to be fed well on a well-balanced diet, to make sure that what she takes will needs increase by 15%. Nutrient requirements may double. Importance of nutrition in pregnancy. The importance is ensures normal development of the baby, meets the demands of lactation and breastfeeding, choose nutrient-dense foods for adequate intake, and the consequences of maternal. There are those three that we have mentioned about: ensure normal development of the baby, then also meets the demands of lactation and breastfeeding, then choose nutrient-dense foods for adequate intake. So the mother should choose foods that are nutrient-dense, the ones that contain a lot of nutrients, so that the mother can benefit from it. For instance, if she wants to have meal that is full of proteins, then she cannot opt for incomplete proteins. She have to opt for foods that can offer complete proteins, like the animal protein, and also she can opt for soybeans, because they are one of those that can give complete proteins. Consequences of maternal malnutrition. Health problems for the mother can develop when the mother is malnourished, and the infant with a low birth weight and the nutritional deficiency may also result if she does not feed well during pregnancy. Nutritional considerations during pregnancy. Caloric needs increase by 15%. So, choose nutrient-dense foods to make sure that this is covered. I've already talked about that. Requirements for some nutrients double during pregnancy. Adjustments in diet to support fetal growth and maternal needs is very, very important. Importance of adequate nutrition for normal development and breastfeeding should also be considered. Physiological stages in pregnancy. So in pregnancy, we start with the implantation, which happens from the first 2 weeks in the first 2 weeks of pregnancy. We looked at fertilization. We looked at where the fertilization occurs at the ampulla, and after the fertilization, when the zygote is formed, that movement from the ampulla until it settles in the decidua and it is implanted, it takes around 2 weeks. So the first 2 weeks are for the implantation. So once it is implanted, now no longer called the zygote, it is now called an embryo. So fertilized ovum attaches to the uterine wall. Embryo nourishes through uterine milk. So as soon as it is attached to the uterine wall, which is now known as the decidua because of the high nutrients that are deposited in it, it is fed on the uterine milk. The uterine milk is secreted by the decidua, the uterine wall during that time when the placenta is still not formed, so the embryo will not be able to get nutrients through any other way. So the uterine wall secretes what is known as uterine milk. It contains all the nutrients that are required for feeding of this embryo. Then nutritional implications during this stage may also occur. Organogenesis, this occurs within 3 to 8 weeks. So when we talk about organogenesis, this is the period of rapid differentiation of the embryo into functional units. Remember, at first, this is just these are just cells. So at this, between the third to the eighth week, there is that differentiation into the different functional units of the body. Then there's the development of organs and the skeletal system. Most congenital abnormalities also occur or originate from deficiency of nutrients during this period of development. That is why it is very, very essential from the time from 1 week up to 12 weeks. It is very, very essential for the mother to be fed on adequate nutrients, to be given all the supplements, and that is why it is during this period that the folic acid is given to make sure that the congenital abnormality of the neural defects cannot occur to the embryo. Then growth, this occurs for the remaining 7 months. So once the organogenesis period is done, the remaining period is now growth. Whatever that has happened between the third to the eighth week was the differentiation of the cells, the development of the different organs and the skeleton. So the remaining period is now for these organs to grow and develop until the fetus is delivered. So in this case, there's a rapid cell growth and the increase in cell nutritional deficiency may lead to prematurity or smaller infant in case the mother well. Nutrient deficiencies, iron deficiency leads to anemia. her stores of iron in the body are boosted. Then vitamin D, and the mother may end up delivering a baby that has rickets. So the mother is encouraged to feed on those food types that can provide vitamin D, and nevertheless also she can get vitamin D from the ultraviolet rays, which can lead to the conversion of the D2. Then iodine deficiency can cause thyroid problems and impaired brain development. Increases the risk of neural tube defects in the baby. This we have already talked about it. Protein deficiency hinders and development. Healthy weight gain in pregnancy. So weight gain during pregnancy is more than just the baby's weight. The mother also ends up putting on weight, but leave alone that there are other things that will also lead to the increase in weight. So fluid volume, larger breasts, uterus, amniotic fluid, and the placenta contribute to weight gain. Extra fluids, water, blood, and amniotic fluid are required for a healthy baby. So recommended total of weight gain is between 12 to 15 kilograms. Pattern of gain is more important than the number of kilograms. What do we mean? We mean the distribution of these kilograms within the 3 trimesters. Because when the mother stays until the end of second trimester, when she's having minimal weight, then in the third trimester she gains too much weight, it means there is a problem. There is some problem. So the distribution of these kilograms within the 3 trimesters is very, very important, and it is what we always watch out for. However, much of the weight, of course, will be gained in the third trimester. So inadequate weight gain increases the risk of low birth weight. Excessive weight gain increases the risk of high birth weight and gestational diabetes. Average weight gain in each area. Blood is approximated to add around 2 kilograms. Extra fluids, that is the fluid retention, can lead to 1 to 1.5 kilograms. Energy stored as fat for pregnancy and breastfeeding, 2.5 to 4 kilograms. Placenta and the amniotic fluid, 2 to 3 kilograms. Then baby is normally 3 to 4 kilograms. Then the breast, 1 to 1.5 kilograms. Then the uterus, 1 to 1.5 kilograms. How much will be gained during pregnancy? So birth weight and the low birth weight babies. Low birth weight babies weigh less than 2,500 grams. Causes of intrauterine growth retardation, undernutrition, maternal size, malaria, and infections. Consequences of low birth weight can be increased susceptibility to infection, immature organs, growth, and development issues. Risks increased for children of adolescent mothers. So children of adolescent mothers have higher risk of low birth weight. And this is because of low socioeconomic status, malnourished mothers, hypertension, viral infections, drug, alcohol, smoking use, and many others. That is why they are at risk. Nausea and vomiting. So glucose excretion increases during pregnancy. So if this one increases due to the effects of the hormones, it can lead to this feeling of nausea, and the mother can end up vomiting. Diabetic women need close monitoring of blood sugar levels. High sugar intake may lead to complications like gestational diabetes, hypertension, premature delivery, and large gestational age fetus. Nausea and vomiting is common in the early pregnancy, like we saw in the previous lecture. So tips to alleviate symptoms include eat before getting out of bed, avoid skipping meals, eat small meals frequently, avoid certain foods and strong smells. Constipation and heartburn. Constipation mainly is caused by the pressure on the bowel as the uterus expands. So this is one of the causes, but also hormonal changes can cause it, and the reduced physical activity can also cause it. So the mother is encouraged to have high fiber foods and fluids so that she can be relieved of such a complication. Tips for managing heartburn: the mother should eat smaller but frequent meals and should avoid lying down immediately after eating food. She should also wear loose fitting clothes to avoid pressure, then eat slowly and chew food well. Drink fluids between meals, avoid spicy, fatty foods, and the coffee, which may end up increasing the heartburn. Cravings and the pica. Cravings for non-food items is known as pica, and this may indicate specific nutrient deficiencies. Like for instance, if the mother craves for soil or she wants to eat clay, it can be a sign that she has low iron stores in the body. So in most cases, when the mother takes her iron supplements frequently, she can end up overcoming this problem. So non-food items can be dangerous for both the mother and the baby. So the mother needs to be briefed on this. Most mothers who eat on clay and the other soil types can end up with severe constipation, which can lead to hemorrhoids at the end. Maternal malnutrition. Maternal malnutrition refers to inadequate nutrition during pregnancy. It can have serious health consequences for both the mother and the developing fetus. Causes of maternal malnutrition can include insufficient caloric intake if the mother is not taking enough foods that can yield enough calories in the body. Then poor dietary diversity. She concentrates on eating specific foods and she does not consider balancing her diet. Then lack of access to nutritious foods, food insecurity, limited knowledge about proper nutrition during pregnancy. Burden of maternal malnutrition. Developing countries face a higher burden of maternal malnutrition, and this is because of poverty. Because the poverty makes you not able to achieve or to purchase what you would wish to purchase, and at the end you may end up feeding poorly. Limited access to healthcare, poverty, and food insecurity are major challenges. Global efforts are needed to address this issue and improve maternal and child health outcomes. Maternal malnutrition is not limited to developing countries. In developed countries, factors such as unhealthy eating habits, food deserts, and socioeconomic disparities contribute to malnutrition. So, in most cases, you may find the mother may end up consuming a lot of calories that can make her to be obese, and that is also one of the malnutrition conditions. Comprehensive strategies are necessary to address this issue globally. Effects of maternal malnutrition increase the risk of anemia, weak immune system, reduce the ability to recover from illness or infection, poor maternal weight gain, increase the risk of complications during pregnancy. So these ones are self-explanatory. Effects of maternal malnutrition on fetal development. There is normally intrauterine growth restriction. The baby will not grow very well because the baby depends on the nutrients from the mother. And if the mother is not getting enough nutrients, the baby may end up not growing well. Then this can result to low birth weight, increase the risk of congenital abnormalities, impaired brain development, higher susceptibility to infections and diseases. Long-term consequences for the mother increase the risk of chronic diseases such as cardiovascular disease and diabetes, nutrient depletion leading to poor overall health, impaired reproductive health, and increase the risk of complications in subsequent pregnancies. So these are some of the complications that the mother may face in the long run, and they may end up becoming very severe. So the long-term consequences for the child, there's a growth and developmental delays. The child will not be able to grow very well because they did not get adequate nutrients. Then cognitive impairments. In most cases, such children, their reasoning will be low because they did not feed well. Increase the risk of chronic diseases in adulthood, poor immune function, reduced work capacity and productivity. Prevention strategies. We encourage adequate prenatal care and regular checkups to make sure that such conditions can be detected. If the mother is malnourished during pregnancy, she can be detected and she can be treated or managed accordingly. Then nutritional counseling and education for expectant mothers. Balanced and diversified diet with sufficient caloric intake, access to nutritious foods, including fruits, vegetables, and proteins, then supplementation of essential nutrients when needed to make sure that the mother has enough stores that can cater for her and also for the fetus. Importance of antenatal care. Regular prenatal visits for monitoring and maternal and fetal health. So the maternal and fetal health are monitored regularly if the mother goes for antenatal. Screening for nutritional deficiencies and addressing them promptly, monitoring weight gain and providing appropriate dietary advice, identifying and managing any complications or risks. So these are the major things that are dealt with during antenatal to make sure that the mother and the fetus stay in healthy status until delivery of the fetus. Community interventions, promoting community gardens for fresh produce like fruits and green vegetables. Then educating families about nutrition and healthy cooking practices, because sometimes we end up overcooking things like the green leafy vegetables and we end up missing the vitamins in them. Implementing food fortification programs, providing support for breastfeeding and nutrition during lactation. Maternal malnutrition and breastfeeding. Breastfeeding is crucial for the nutrition of both mother and the child. Malnourished mothers may have difficulties producing sufficient breast milk. Why? Because they will not be having enough nutrients that are required for making the milk. So proper nutrition during lactation is essential for the well-being of the baby. Socioeconomic determinants. Poverty and limited resources contribute to maternal malnutrition. Addressing socioeconomic disparities and provide support are important for preventing malnutrition. Collaborative efforts. Governments, healthcare organizations, NGOs, and communities must collaborate to combat maternal malnutrition. Implementing policies that promote access to nutritious foods and prenatal care. Conducting research and sharing best practices for effective interventions. So this is very, very important to make sure that this problem is combated. Addressing maternal malnutrition. This can be done through empowering women with knowledge and skills to make informed decisions about their nutrition. Promoting gender equality and women's empowerment to address the underlying causes of malnutrition. Advocating for policies that prioritize maternal health and nutrition. Ensuring the inclusion of maternal malnutrition in national and international health agendas. Lobbying for increased funding for nutrition programs and research. Continued research on the causes and consequences of maternal malnutrition. Strengthening health systems to improve access to quality prenatal care. Integrating nutrition interventions into existing healthcare services. So this does not need much explanation, but it is very, very clear and easy to understand. So thank you so much for being part of this lecture. May God bless you.